Welcome to Exercise Leadership 2. We are in the second part of Chapter 7, more functional assessment stuff. So again, there's going to be a lot in here that is really not useful at all, but we'll go over it and explain why. So 5 basic movements that they're going to talk about in here: the bending and lifting movements, single leg movements, pushing movements, pulling movements, rotational movements. Yeah, most stuff can kind of fall into that. We do a lot of things that cross over within those, but that's a good way that you could put a lot of your movements, right? Again, when we single out certain joints and things, we get into different rotational movements than what they're talking about in here. But again, if you want to kind of simplify daily living activities, they sort of fall into these groupings. Okay. So movement screens generally challenge clients with no recognized pathologies to perform the movement. So again, if somebody's got any injuries or like whether acute or chronic or any other impairments and stuff, be careful with how you evaluate them. You don't want to hurt them. And again, they won't be able to perform certain things anyways. Again, you can evaluate stability, mobility through the entire kinetic chain. And if pain arises during any screens, you're going to stop them. Okay. Now, again, we'll talk about whether or not you really need to do any of this to begin with. Okay. So bend and lift screen. Examine symmetrical lower extremity mobility, stability, and upper extremity stability during a bend and lift movement. So again, you're doing a squatting, or this technique you're going to use when either you're squatting, you're doing deadlift, getting down in these positions prior to doing any Olympic lifting. If they're going to do any of that, it's going to be important. So again, doing this screen, you can do this like they're doing with the PVC pipe. The other thing you can do is, again, ask them to do a squat. So just do like, show me an air squat, right? And again, see, by doing this, you've got to have a certain ability of balance and things that a lot of people may not have to be able to get down in this position with their hands straight down at their side. You'll find a lot of folks, even folks that have worked out for quite a while, really have not developed good technique on their squats. And to be honest, you're going to be teaching this from the get-go. It's very rare that I find somebody who has good squatting technique. So you're probably not going to see what you see here, right? So just understand that even assessing this, for most part, is going to be very unnecessary, because like I said, you're going to be teaching this movement anyways, right? So again, he wants you to observe stability of the foot, observe the alignment of the knees over the second toe, observe overall symmetry of the entire body over the base. Right. And so each time that they're doing that, sometimes you can do it even within the first one, especially if you have them go down slowly and come back up. You're going to notice which leg they tend to push off more, which, like if they have any tendencies to put one foot straight, one foot out. And again, with their hands down like that, you may have some balance issues. So again, I would actually allow them to have their hands free in case they need to use them to counterbalance as they go down, especially, like I said, most people have never squatted correctly before, especially if they've never been taught to. So again, I don't want to watch them do a lot of repetitions of doing things incorrectly. In all honesty, I want to start correcting it as they do it, right? It's, we want them to learn to do something right, not just sit there and watch them do it wrong. Okay. Again, watch from the front, watch from the side, watch from the back. Okay. So again, if you'll, if you're watching them, you have them do like 5 this way, you have them do 5 this way. Oh, they don't do the back. And if you do 5 from the back, that's 15 reps, and those are going to change over time as well. So you kind of want to, limit it to like just doing a few of them in the front, like do 2 or 3, watch them from the front, 2 or 3 from the side, 2 or 3 from the back. And again, Observe whether the heels remain in contact with the floor. Again, what you're noticing here is if they get too far forward, their heels will lift. Are they glute or quad dominant? You know, a lot of times you're going to see that, you can see that in posture, which one it is, or again, you can ask them like, which muscles do you feel like are really pushing or getting fatigued, right? Do they get to parallel position or not? You know, how far down can they go? You know, and again, why is that being caused? And there's a lot of things that can cause it. Again, the most common would be like, yeah, they're, you know, they have tight muscle groups, things like that. The other one is they don't feel comfortable balancing that low. They've just never really done it. This is new for them. You got to realize a lot of people, when they come to you for fitness, they're not used to performing like true squats. Most people hip hinge to pick things up off the ground. And so getting their knees bent down into positions, you know, unless you get, you know, like getting folks down real, like, especially if you think about folks that get really low, like a catcher or something, there's not a lot of people that get down in that position, especially adults. Okay. Um, Degree of lordosis, you know, again, are they arching their back too much? Are they rounding their back? You know, what are they doing? All right. And then head position. Again, most people don't really know where to put stuff. So to be honest, when you're doing this, you're really assessing their knowledge of how to squat more than you're assessing if they have any problems. Okay. And you're going to see that in this book, the book is going to tell you if they're not doing any of this stuff right, it's because they have mechanical problems, they have muscle problems, they have length tension problems, they're too strong in areas or too tight in areas and too weak in areas, which, yes, a lot of that can be true. But what you got to realize more than anything, you're assessing whether or not somebody's been taught how to do this correctly. And that's the better observation, because once you teach them how to do it correctly, and then they start saying, like, I get what you're saying, and I'm trying to do that, but my leg won't let me, or my knee won't let me. Then we start to observe what actual physical issues they might have. But again, if you're just going to ask them to, you know, if you're going to just tell them from the get-go, like, okay, squat down, I'm going to have you hold this thing, I'm going to watch you, without giving them a really great tutorial, more than likely most of their problems is they just don't know how to do it. And then you're really not understanding what's going on, right? Again, this is a this again is one of those tests that really is going to tell you more than anything. Balance, you know, it's balance, balance, balance. A lot of people don't stand on one leg. So when you ask them to move while standing on one leg and perform things, they're going to have issues with balance, right? So if we're looking at mobility issues with this, it's going to be a lot harder to determine if this is not something they tend to do. So if you notice on the first one, you know, this lady doing, you know, yeah, she's well balanced, you know, and the second one, not so much. And again, you'll probably see the second one more than the first one because most people don't stand doing these things. And maybe you'll see it great on one leg because they have that one leg that they typically balance on if they do anything, and they'll have that other leg that they don't. Okay. So again, stability of the foot, alignment of stance leg, you know, are they having to shift from one side to the other, right? Again, you know, this is a new thing for somebody. I would honestly give them plenty of time to, you know, and again, please instruct them for what you want. You know, you want them to try to keep their shoulders stabilized. You don't want them shifting left to right. You want them to get their knee up over, you know, the line that you set, right? So if they were going to step over, okay. Again, you know, a lot of this can be fixed with good instruction and practice. Because again, these aren't typically things that people do in their day-to-day environment, right? Um, Again, shoulder push stabilization screen. Again, make sure that while you're doing this, that you give them good instruction on how to do this. Sometimes winging of the scapula is due to underdevelopment and things like that. Sometimes winging of the scapula is because somebody doesn't know how to actually contract those muscles while they're doing a push screen. A lot of times when people push, they really don't stabilize in the back, and hold everything tight, and it's just something that over time you learn to do. The more that you've exercised, the more you do this. But yes, winging can be under development, especially a serratus anterior, especially if you see wing on one side versus another. Sometimes it can be long thoracic nerve issues and things like that. So it can be due to some issues, and also again can be due to the fact that they've never been taught to stabilize their back. I notice this typically more in adult women than men. um, I think a lot of times, especially I don't know, and again, it's not being sexist or anything, but I think typically when guys have been through any type of training for sports or anything else, and they've had a coach and they make them do push-ups, there's usually a coach when they notice the shoulder blade stuff, man, they get onto them. They're like, tighten your back, and they have them stabilize and things like that. And for some reason in women's athletics, or you just maybe working with female clients, I might get a lot of clients that maybe have not had athletic backgrounds. I've seen this more often. And so again, this is my personal observation. I don't know if it's true across the board generally, but when I've worked with clients that haven't really done a lot of, formal adult exercise training, I typically see this more in adult females versus adult males. But I have seen winging in some of the adult males again and again. Usually with them, they were folks that had zero um, athletic experience, earlier in their lives. So that's usually, from what I've found with it. I've yet to have somebody that actually has um, their scapulas that are weak, or they've had serratus anterior issues, or they actually have like a lung thoracic nerve issue. Although I've seen that in textbooks and stuff like that, I haven't actually dealt with it where I've had somebody do that. And I've had it where they're either bilateral or unilateral. They don't realize what they're doing on one side versus the other. Um, so again, this is a lumbar spine rotation drill that you can do. Again, they're not going to have a whole lot of turning in it, but what you're looking for in this is, how far can they turn without adjusting their body and doing some goofy things as they do it. Again, I don't know that you really need to um, measure this at all. Again, like I said, you're going to see throughout things. A lot of times these are just things people have never done, and you trying to explain to them how to do it correctly doesn't usually help them. Again, these are what again, you're asking them to be very specific in how to hold their body while they're doing a motion that they typically don't do while they're holding something and trying to hold their body doing it. When something's not natural, it usually takes a while to learn it, right? So again, um, this, says possible biomechanical problems. Again, unless you're going to sit there and spend a lot of time teaching them how to do that motion, you really have no idea. Okay. Um, Again, if you want to test these, again, if you want to test flexibility and things like that, I strongly suggest, get a goniometer and you can put them through all the range of motion tests. That's fine. And again, um, that's a better indicator of maybe some issues that you may want to work on with your clients, because it may cause some movement issues as they're learning certain movements. So again, if that's something that you and they have agreed on to test range of motion, and you're going to bust out the goniometer and look at all their rotational stuff and flexibility and all that, that's completely up to you and them. And again, that actually, I'll say, holds some merit. It just takes some time, right? Thomas test. This is a pretty common test that looks at hip flexion, quadricep length, or basically tightness is what you're looking at. So again, you're looking at whether or not somebody's got flexibility. As they pull one leg, the other leg's gonna typically want to come up with it. So this girl right here is doing well. She's kept her other leg up on the down on the table while she pulls up. So again, typically what you're going to see with that with most people is as the leg that's being pulled up is that they pull it closer to their chest. You're going to see their other leg start to move up with it. Okay. So again, what you'll see here is with the back sacrum flat, the lower thigh does not touch the table, but the knee does flex to 80 with the back sacrum. You see here what muscles might be suspected as being tight. And again, these are common muscles. And again, once you implement more stretching and movements and stuff, you'll typically see this get better over time. Again, just checking hamstring flexibility here. Again, rather than doing the manual tests, like even the Thomas, you can do these, you can do this. I would actually goniometer test this if I was actually going to look at it. I can already tell you 90% of 99% of guys that you're going to do like hamstring test on, they're going to be tight. You're going to have some girls that are going to pass really well and you're going to have some that don't, but yeah. And again, most people are going to fall under the tight hammy range with this one. Shoulder mobility. These tests aren't bad. The flexion, extension, internal, external rotation, Apley scratch tests are all fine. The thing about the scratch test that so the first ones, to be honest, you can goniometer. The one about the scratch test I like, that's a little bit different, is you're not just measuring one aspect of range of motion on that, where like the other ones you can do, like you can check with the goniometer and all that. But this one, you've got them, you've got them in like kind of a lateral adduction plus a flexion type thing. And then they're reaching back behind and you're looking at how they're going to have to move the scapula to allow for more motion as they reach behind. And, you'll see a lot of times with this one, what you're going to see is the left picture and the right picture happen at the same time, and see if you can lock hands. But so that one adds a few motions in one, which is fine. Again, we'll kind of skip through these. Like I said, if you really want to look at external, internal rotation, shoulder extension and all that stuff, I would honestly just get a goniometer and test all that out. So we'll go through more of these screens. Again, if you really want to know flexibility, test for flexibility. The other tests, to be honest, to me are more of a do you know how to, not whether you can, because again, you can't determine whether or not somebody can or can't do something based on the limitations of their body until you teach them or try to teach them how to do something correctly. Okay, so you got to be careful with that. Anyways, that's it for today. And we'll go over 7.3 tomorrow.